Welcome to Clapback with the Facts podcast,
the Not Our King miniseries edition,
where we are providing you with the information you need to know about what's politically impacting Black women across the country. In a world filled with mis and disinformation, we provide you with the real. If you're a Black woman, representing Black women, or in the community with Black women, we are here to clap back and give you the facts.
Thank you for joining episode 6, Make America Sick, Not Again, the erosion of America's public health at the hands of RFK Jr., the Play King miniseries. We will be sharing the facts and dropping gems, so let's get ready to clap back at the facts.
All right. Hello. We are back again for episode 6. We are continuing our Play King miniseries. So, we were on talking about Congress, but now we are back on the chief administrator himself, Donald Trump, once again. And this time we are going to be focused. I guess we're not on Trump. We're actually going to be on Robert F. Kennedy Jr., known to some as the Secretary of Health and Human Services, serving under the Play King. And our goal with this series is to really highlight some of the administration's policies, talk about the impact that they're having on real people, especially Black women, and to really think through whether or not this is what we envisioned under a Make America Great Again policy. Now, we could all criticize the idea of the great and again part of it all, but taking it just at face value, let's see ultimately if what is happening here makes our lives better, worse, crazier, or somewhere in between. Well, I'm not having this discussion by myself. It is important for us to bring up all the perspectives and hear from different voices that come from different point of view. So help me in joining my co-host, Simone Henderson, and she's Chantelly M today. So we're going to go with that. Chantelly M, Chantel Mullins. All right. Welcome, ladies. Hey,
ladies.
All right. Well,
how are you?
Child. This show, I'm going to admit, is probably going to have me betwixt and between, not because of the impact I'm feeling today, but because of what I know is coming down the pike. It's just anxious, and I'm going to try to get through it without freezing and without sounding crazy and without cussing if I can, but don't hold me to none of the above. So I think one of the things in terms of us setting the stage is, and Chantel, I'm going to lean on you because you have, in our ecosphere, you were kind of playing the role of the mini expert around Project 2025 and actually went on a bit of a tour.
I did.
Speaking to our partners, and especially in the States, around the impact of Project 2025 and some of the things proposed. When you were doing that and in that role, what were some of the things related to health and human services and really healthcare in general that you felt were problematic as a part of Project 2025? Because I want to harken back to make sure people get the connection between what we saw and what they were speaking about in terms of Project 2025 and where we are now. Because you may remember during the campaign when the criticism got too hot on Project 25, candidate Trump was like, oh yeah, I'm not doing that. That's not me. That don't have nothing to do with me. And so here we are. So I want folks to kind of really get how all these pieces connected. So some things that you would lift up out of Project 2025 and Health and Human Services in particular that were alarming back when we were in the campaign.
Well, and you know what, Holly, that's a really good place to start because all of what we're seeing is part of a playbook that was publicized. And so when we look at Project 2025, all of the agencies that you see that are being dismantled was part of it, particularly the CDC, particularly Health and Human Services. So there was a real concerted effort to delegitimize, create a skepticism, create doubt around particularly vaccines, and science in general. So there is a concerted effort to undermine science and have people not trust science. And so in going and putting in a known vaccine denier, you're getting people whose responses are, well, this isn't that serious, or it can be cured through alternative medicines. Don't get me wrong. There are some great alternative medicines, but usually those alternative medicines are also backed by science. And we have a tendency to forget that. There are some great off-label uses for drugs that have been developed for one thing, but you find out that it's a great use for something else. Take in chief Viagra. Viagra was made as a heart medicine, but we know that ain't what it's being used for.
Not exactly.
And ain't nobody cut off no Viagra funding. That's all. So but we have a whole group that is dedicated to dismantling science and research, and it is going to set us back, not only as a country but as a nation, because we learned quickly during COVID that diseases don't have a boundary, and someone who can get on a plane somewhere at 8 o'clock can drop a disease somewhere around the world at 8 p.m. if they get on a plane at 8 a.m. And so, we have to be mindful that when outbreaks are occurring in other places, that those aren't going to just be contained. We really are a global world. We've got packages being delivered. We got people being delivered. All of those things are happening. And yet we have people who really don't believe in any of that. They don't believe. We should have learned in 2016 that they don't believe in preventative medicine.
Right.
Because they threw, the whole, one of the things that happened is they threw the whole pandemic playbook out.
Yeah.
When that other person got in office, when, President Obama had a very robust pandemic plan, yet they threw that plan out.
Yeah.
And we saw the ramifications of that. We did not have to have the level of deaths that we had. We could have had a better and more strategic plan for addressing all of that. And yet we did not, because we have people who don't believe in that, and they thought, their ice was colder. It resulted in morgue trucks outside of hospitals.
Oh, Lord.
Something that you started to hit on that connects is when you said, once the attention in this all wasn't popular, then the language shifted and the language changed on the campaign trail. And that the language that they used to usher in RFK and to create this pathway was around vaccines, because they knew not that it was divisive to the level that they were perpetuating it to be, because it's not. I think majority of Americans, majority of people around the world trust and utilize, and we live in societies are maintained by vaccines, and we understand and we know that. But using that as their gateway and their dog whistle to be able to open up to, like you said, Chantel, their ability to dismantle science, research, and this health industry has really been what they used it for, is that was their vehicle to do so. And I think not only with that, and I think that's a huge part of what makes 2025 so dangerous, what made it so dangerous. I think that's the importance of this miniseries, and we talk about the early days of this administration, is it's not the dog whistle that everyone has to pay attention to that they're using. Look beyond that and say, well, if this domino falls, what's behind it? Because 9 times out of 10, if not 10 times out of 10, that's what they're really trying to break down. And they're just using the easiest thing that catches folks' attention to say, well, if we don't like this, let's just get rid of it, not knowing that once we give them an inch inside the door, that they're going to shut the building down.
Yeah, that's right. That's right. And I think the biggest problem, and one of the themes that we are going to see as we continue to explore what these policies, the impact of these policies is, much of it is being done under the generic term of eliminating waste and boosting efficiency. But part of our problem here is that we don't really have a definition for waste nor efficiency. And they have to use that language because really what they're trying to do are actually, let me be clear, what they're telling the American people that they're trying to do is to balance out spending to create bigger revenue. Well, what does this larger revenue pay for? It pays for more tax cuts and benefit credits to billionaires who live in this country. See, part of our problem is our theory about what government should do and how it functions is being run by someone who has absolutely no respect for our democracy and absolutely no commitment to servicing the American people. And in this case, in this rare case, I'm actually talking about all the American people. But the impact that it has on Black people, and particularly Black women, could have catastrophic impact. So first and foremost, let's just talk about this whole restructuring piece. One of the things he wants to do, I want to Chantel, thank you for the primer on Project 2025. I want to note the outcomes of what Project 2025, some of them that have come up, and then we're going to look at some of the changes and see how, again, Simone, I really appreciate your comment about language, because what we're going to see when we go through this is that while it's not using quote unquote Project 25 language, it is having Project 2025 impacts.
Mm-hmm.
And that's the piece that we got to get clear about. So what are some key areas under Project 25? One, first and foremost, CDC. That is the Center for Disease Control. They want to deal with prohibiting the CDC from being able to issue guidance around vaccines, masks. They want to prevent them from just, in other words, limiting its public advocacy function considerably. So this is basically, they want them to think about them. They want to think about how the CDC operates while taking away any social impacts that it may have. Second, they want to restructure health agencies so that we are looking at agencies that do data and agencies that do recommendations are not the same. And what the hell sense does this make? What the hell sense does that make? We're going to take the data away from the policies. Keep an eye on that one. Of course, they want to push a restrictive, very restrictive anti-abortion agenda. They want to wipe out protections for LGBTQ plus. Again, they want to make sure that the data and the policies do not talk to each other when they look at things like census and data collection. DEIA is completely out the window. They want to look at making sure that vaccines and research are limited and are not used to further develop vaccines. Look, it's the vaccine that just took us out of a freaking global pandemic. But no, ain't no more bad diseases coming. We don't need to even think about research. And then understand the impact of climate change on our health. But yet, let's get rid of that. And then finally, they want to have a significant rollback in government workforce. Now, their reason for the significant rollback has nothing to do under Project 25 with race and efficiency, but more to do with being able to replace government civil servants with individuals who align with the administration's ideology. So recognize this does not just come together in terms of people being efficient. You're going to see all of these roles get refilled. The difference is they want to refill them with people who share the current administration's ideology. But how do we do that? We got to clean the house first so we can bring in basically all the people who align with doing very harmful things to our community. This is how, even after this man is no longer the play king, there may be influences that are with us for generations as people work in government for decades. Who will be advancing harmful policies against us for a lifetime. So let's not be fooled by what is happening. So,
well, Holly, I wanted to jump in because since I was out here on this tour, talking to people about Project 2025, one of the things that I found was this great tracker that someone had done, and if we could drop that in the chat, I think it would be helpful, because if you actually look at Project 2025, there were 27 specific things that dealt with that were in the Department of Health and Human Services and the CDC. 4 of them have been completed, and 8 of them are in progress. And as you were going through the list, I was thinking, yep, because they've reversed the prohibitions on gender identity discrimination. They've ended the data collection on gender identity, reversed the discrimination protections for pregnancy. So you can discriminate against pregnancy. This is the pro-life folks. You can discriminate against pregnant folks. The Hyde Amendment has been in their crosshairs forever, so they're making sure that that's enforced. Prioritizing traditional marriage in its messaging. Going after Planned Parenthood is in the crosshairs. Rescinding the guidance that the Biden administration had put out that required hospitals to do an abortion for an emergency to save a woman's life. They were like, we want to get rid of that. That's not good stuff. Now, if you are trying to adopt and you are same-sex couples, nope, you can be discriminated against. They're trying to rescind that. Y'all, they trying to get rid of Head Start.
Listen, while you talking, I'm gonna put the tracker up so we can see exactly what you're talking about. Go ahead.
Yeah, Head Start. Can't withdrawn the guidance that pharmacies must dispense abortion medication and contraception. wait, Biden had strengthened the HIPAA protection around our reproductive health care, the records. They trying to get rid of that. So, it is just, this is a great, great tracker.
Yeah.
Whoever this is, they have done a phenomenal job. I actually had tip off to them because this is some next level work that really enables you to do a deep dive, or you could find what you need. But they actually, as Simone was talking about, they actually moved away from, we don't know nothing about Project 2025 to now they have nominated and appointed a whole bunch of folks, including the chief writer of Project 2025. I believe he's over in the financial, what's that agency?
Is he there, or is he in OPM?
Well, there's one in
He come
OPM.
from OPM.
There's another one. The main one, I believe, is in the financial bureau.
Well, we'll have to deal with him in one of our upcoming episodes, but let's stay focused on healthcare.
I'm sorry.
So I just want to note here at the top here that even in just less than 100 days, 3 of the 20 objectives, and we just less than 100 days in, are already done and over with. And that is, as you pointed out, the reversal on healthcare discrimination based on gender. That's out. Reverse prohibitions on healthcare discrimination based on pregnancy. And that includes abortion, but this is on pregnancy. So this is much wider than abortion. And then enforcing the Hyde Amendment, which bans any federal funds from being used for abortion, even abortion counseling. This means I can't even give you information if I receive funding from HHS. And this is just the beginning. So yes, thank you, Chantel. This is a wonderful, 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 wonderful thing. And I want to also note these little gray bubbles are things that haven't even gotten started yet. But that are going to be a big part of what moves forward. And I mean, honestly, what do we have against the kids? How come we can't fund in-home childcare? Incredible. Just incredible. All right. Well, we have so many things to talk about with this foolishness. I just want to announce that another round of decisions under the so-called Transformation to Make America Healthy Again were released at the end of March. And this is where we're going to see another big hit on a round of jobs. Now, we're looking at a reduction in workforce of, they're going to say 10,000 full-time employees, but overarching, the goal is 20,000. Based on what?
Based on what? And I think in that it's important to note that the AP reported that the way that they're essentially justifying this is that HHS's new spokesperson, Andrew Nixon, has come out saying that the reason behind all of this is that HHS will no longer waste billions of taxpayer dollars responding to a non-existent pandemic that Americans moved on from years ago. And I think in that, for the multiple frames that exist there, is that we have a number of states across the country that are suing the administration for their want to reduce and cut $11 billion of federal funding that go towards pandemic-related reliefs that continue, as well as other health initiatives. And I think in that, you also have the just complete lack of sensitivity, empathy, and for a large part, ignorance to the devastation that people are still feeling, that industries are still feeling. How many restaurants and businesses and whatnot closed during the pandemic? They aren't back open. People still feel that. How many people, the millions of people that died from the pandemic. They aren't just waking up and saying, oh, that was just yesterday, it's time to move on. So I think, and the things that the health impacts that subsequently came out of those individuals who are dealing with long COVID and things that have transpired from that, that they still need services to help move beyond something that this administration, not this administration, but that same president was responsible for causing in the first place. And so then to turn around now that, President Biden came in, provided the infrastructure and the funding to continue to combat the pandemic when Trump didn't want to, you're going to show up and undo it again. So I think going back just to the point of using vaccines as an initiative, as a vehicle to get in, to then dismantle things in a way that we haven't seen. And certainly, I mean, ladies, I'll let you all chime in. What does it look like the last time we've seen something be dismantled like this?
Oh, my goodness. Well, first, let's talk about the scale. We're talking about 28 divisions that live under HHS, and they are reducing 28 divisions to 15. Now, I'm not suggesting that there isn't any redundancy, but let's proceed in a way that helps us to get to the kinds of outcomes that truly make us healthier again. And I would submit that separating things like data from policy is not going to help us get there. I would also submit that reducing the number of regional offices from 10 to 5 will actually increase the amount of bureaucracy because we'll have less access to real people. Something really key that you just said, Simone, and that is HHS delivers what? Services. And services are provided by real freaking people.
Yeah. And then I think something, ladies, drawing it all back, is what does this mean for Black women? What does this mean for our communities? If we already know that there are severe health disparities across the country, especially in southern states, the access to different resources, and then you see this combined with the of the work that they're doing across other agencies to reduce demographic specific solutions for community specific problems. What does that mean at the reduction of HHS overall on Black women and their communities?
Well, this is what we have to discuss, and this is a problem. I have background noise happening, so I apologize for that. But I want to also deal with this idea of the new Assistant Secretary for Enforcement. And this person will be over the Department of Appeals Board, the Office of Medicare Hearings and Appeals, and the Office of Civil Rights. Thoughts?
Ain't nothing's getting through. Appeal if you want to. That says appeal if you want to. If you want to waste your time, by all means, fill out the paperwork. It'll be delivered. It'll say return to sender.
Definitely. I mean, they're breaking the system intentionally. And, one of the things I think people are going to slowly start to experience is you never miss your water till the well runs dry. And so a lot of these things don't impact everybody, but for the people that they do impact, they're going to start to feel them. And then they're going to realize, oh my gosh, this is what this was. And so, government is a service. It is not a business. It is here to serve the people. And, people are going to miss those things once it starts to happen. Like we're already starting to hear about people missing Social Security check payments. when stuff starts to break and really starts to break to a point where people are going to really notice it, I'm afraid it's going to be too late, and there are going to be people who suffer unnecessarily for that because of it. And I think that is the saddest part of all of this. I'm a firm believer in process improvement. There is nothing that cannot be improved. So I don't ever go into a conversation talking about there isn't something that couldn't be improved. We are all a work in progress. Everything that we make is flawed. But there's a difference between waste, fraud, and abuse, which they haven't proven. They've just said, oh, this is waste, fraud, and abuse, and we're going to go in and start cutting. There's been no analysis. You haven't talked to the people who work there. They are experts in their work. They can tell you where there are some redundancies. They can tell you where there are system improvements. The thing is, they've not asked anybody. They've walked in, they said, we're the experts. We're going to tear this to the ground. And we've already seen across various agencies where they fired people and went, oops, we didn't know what they were doing.
Chantel, you just said something. It's like they didn't ask. They don't care. And what just stuck out to me is, well, they don't care to ask. They don't care to ask. They don't care the impact. And they certainly, by their course of actions, don't care about how this will disadvantage and harm Americans. Because if they did, then they would have.
Well, they believe that they are the experts.
They can't. They can't.
You know what? Whether they can't, they do. They believe that they are the experts and nobody can tell them anything. And so with that, we get what we get. They're going to tear up some stuff. Unfortunately, some people are going to be harmed. Hopefully, the only thing I can pray about is that the harm is mitigated. But there are going to be people who are harmed. I mean, there are people right now who are in the middle of clinical trials.
Yes.
And the researchers are gone. The program is gone. And these are people all up and down the health. It is just unfortunate that they have not, there is no care in what they're doing. There is, and I don't know who is religious or who's not, but there's no God in what they're doing. This is the most godless, horrific. This is the way you treat your fellow man, even if everything that they believe is accurate and correct. This is not how you treat people.
And this is not going to do anything close to what they think it's going to do. And I want to note here again, because as Simone shared with us, this language is so important. Their goal, they say, is to end America's epidemic of chronic illnesses by focusing on safe, wholesome foods, clean water, and the elimination of toxins. I want to note here that they're not focusing on prevention or research. No. And the lie that they tell about clean water, wholesome foods, and environmental toxins have already been announced as they talk about it as part of their rollbacks. Why? Yep. Because they are reducing and restricting people like the Food and Drug Administration from being able to regulate toxins that go into our food. So where is this safe, wholesome food when you don't have the FDA protections? Where is the clean water and elimination of environmental toxins, when you are rolling back the protections that make it possible?
And we spoke about this. We spoke about this in season 1 when we spoke about the Supreme Court's decision to overturn Chevron and what could be possibilities. And so when we look and we are in forecasting for some of the things that we're talking about, these are the real impacts that we say this was step 1, and we're seeing right now that this is what they wanted to happen. They knew how to strategic things in order to be able to roll it back in the way in which they wanted to, bringing us all back to what you laid out for us at the top, Chantel, was Project 2025 and exactly what it aims to do and how they systematically went about doing it.
Well, in the infamous words of our former vice president, I don't want to say I told you so, but
I told you so,
girl. So listen, we're here, but in our fashion, we don't want to just be doom and gloom. We don't want to make you think there's nothing you can't do. And so, before I go to the call to actions and things you can do, I do want to also note that we need to be especially critical and watchful of the reorganization of the Administration for Community Living, because they are looking to consolidate programs that support older adults and people with disabilities. And this includes the Administration of Children and Family. This includes ASPE and the Centers for Medicare and Medicaid Services. They're saying that the reorganization is not going to impact Medicaid and Medicare, but don't be fooled. The reorganization will because of the layoffs, and it will also get impacted again because of the freaking budget.
Yeah.
So we're going to have to be careful and take care of our most vulnerable citizens, children, older adults, and people with disabilities. But there are things that we can do. What are some of the things that we can do, and what should people be doing facing this unhealthy America plan?
I think that we have to I think what we can do is one thing that remains important is that there are 23 states with active lawsuits that are suing the Trump administration over the funding and the cutbacks and the rollbacks. And I would say, take time to research if your state is one of those 23 states and what exactly they're trying to protect. Is you need to know what is at risk. One, understanding and assessing yourself. What are your needs? What are your healthcare needs? And understanding just how they're at risk, so you know how to support the different folks that are fighting to keep those elements, and where you can be a supporter for them in their efforts.
Yeah, absolutely. Chantel, you got any thoughts, wisdom, words of advice for the people who are out here about to be experiencing all the foolishness?
Well, one, find your community.
Yep.
Because the only way we're going to get through this is together.
Yes.
So find your community and those who can help you. The other thing is, and I wholeheartedly agree with what Simone said, there are people out here fighting the good fight. And, one of the things that I have started thinking about as I see people say, what's the plan? What's the plan? What's the plan? Well, what I would add is the plan is different based on where you sit. Because if you are in the advocacy space or the legal space, a lot of that is around lawsuits and enforcement of laws. And so you see those organizations organizing. And so help them out, because lawyers ain't cheap. They're paying for those things. There's a legislative plan. And the legislative plan is going to be different again based on where you sit, because you know the Senate has a plan, the House has a plan, the party structure has a plan. There's an election plan. So you see a lot of people who are gearing up, thinking about midterms, but also all of these local elections that are happening in between. We've got to people have to pay more attention to those local elections, because we didn't get here in a vacuum.
You know, right before we send it right back for Holly, you to close us out with the word of what we need to do. What you just said, Chantel, I think it has to be echoed, that freedom and democracy have to be maintained. It's just not something that you just achieve and think that it gets to exist because you fought for it to get to that point. It must be maintained. And I think we are seeing that it's requiring more effort than maybe it has in a lot of folks' lifetime. And so what it looks like to show up and to be a part of those plans and to research may be more time consuming than they've ever had before. But by no means does that mean that you can't not be a part of it.
Absolutely. Proactively, I want to echo exactly what both Simone and Chantel have said. You need to be engaged. You need to find your community. That's what you can do right now. Doing just those two things will help you to survive and perhaps set you up to thrive for the future. However, you also need to, this isn't a but, this is an and yes, the list is a little bit longer because these people making us work harder. Okay, so I'm sorry that the list of things to do is long, but here we are. Also, we need to start thinking about how we can set ourselves up for better outcomes in the future. And one key opportunity coming up in less than 2 years is for us to shift the Congress. We need people in Congress who are about data and facts and policies that service the American people. And I'm sorry, those used to include Republicans. They do not include MAGAs. And if you find me some good old-fashioned Republicans, I'd be all right with them and the Democrats. But MAGA's got to go. And so anybody who is speaking about and upholding policies that are about Trump, and if you happen to be in any demographic outside of a rich, white, normally billionaire class person, these policies are against you. Y'all might not have wanted to be in the same boat as us, but here we are. And then as I was talking to some of my friends in the medical field and in the health professions in the last few days in preparation for this conversation, and this is a little bit out the box, but use your social media and use the ability to communicate globally to also keep your eye on global health outcomes. If you have a specific ailment or specific chronic disease or frankly any kind of health policy or concern that is impacting you personally, look at organizations like the World Health Organization, look at global research centers that may be conducting this research, because even though we are on the Make America Unhealthy plan, the rest of the globe is not. And you may find that you will need to entertain or consider foreign healthcare services to get what you need in order to survive. And so I am talking to many health professionals, particularly Black health professionals, that they themselves are leaning into not relying on American sources exclusively to understand what is going to be happening in the future, especially around health research. Because as we roll back, the rest of the world steps up, and we're going to find ourselves in a situation where they're going to be the leaders and we're going to be left behind. No pun intended. All right, that's been our show. We will be back. We have so much more to talk about when it comes to the administration of the Play King. Chantel and Simone both have given us a little preview of some of the stuff that you can expect coming up. So in the meantime, share this with your friends and family. Like, subscribe, drop comments. Let us know how we're doing. We love to hear from you. And we will see you again next Thursday. Bye.
Thank you for joining us here on Clapback Get the Facts podcast. We hope that you're leaving feeling more informed and ready to provide others with the facts. We would love to hear your biggest takeaways from this episode, so post the show on your Instagram story and tag us at Sisters Lead. Also, if you haven't already, don't forget to subscribe so you'll never miss an episode. And while you're at it, please leave a review so others can get some sense of the facts that we're providing. Finally, if you would like to learn more about local resources and other projects we're working on, go to sistersleadsistersvote.org.